Well, good morning, everyone. My name's Dominic Dodd. I'm the chairman of the Royal Free London Group of Hospitals. And I have to admit, I have been really looking forward to being able to say, welcome to the official opening of the new Chase Farm Hospital. And I'm particularly pleased to welcome His Royal Highness the Duke of York to be with us to mark this occasion. We're very proud of what we've done as a team to get to today. It has, as the redevelopment of Chase Farm Hospital has proceeded at an unprecedented pace. So it went from drawing board to welcoming our first patients within just 4 years. And the time between approval and finishing the building was 2 years and the fastest in NHS history. And it was achieved under budget. What we have here is not just a new building, but we have a new kind of hospital. It's defined both by what it contains and what it doesn't. So it contains some welcoming, well-designed space with patient dignity and care foremost in mind. It contains some fantastic innovations in design in theatres and elsewhere. But it also doesn't contain paper, or very much of it. It's at the forefront of the use of technology to make for safer and more caring and effective healthcare. And it doesn't contain much that's not to do with direct patient care. So a lot of the vital supporting services, like sterilised services down the road in Chalk Mill Drive, are provided at expert sites that are providing for many hospitals at the same time. So while it's a wonderful new facility for the local community here in Chase Farm and Enfield, it's also a pioneering experiment with relevance to the rest of the NHS. But there are lots of things that haven't changed, and chief amongst them is our wonderful staff. And I'd just like to pay tribute to the Herculean efforts of our staff in running 2 hospitals alongside each other, in transitioning safely from the old to the new, and in doing that by retaining the culture of care, compassion, teamwork and community that so marked out the old Chase Farm Hospital and now breathes life into this new hospital. And the other thing that hasn't changed is that we like to pause at these special moments and remember them for future generations. And I will be inviting His Royal Highness to join me and Zoe Ademi, who leads our urgent care centre, and Mercy Stanton, who's a theatre sister, to bury a time capsule. And one of the lovely twists in the story of the new Chase Farm Hospital is that during the building works, we discovered a time capsule that had been buried in 1884. And you can see something of the contents and more of that story from what people 135 years ago thought we would like to see inside the marquee. So for our part, what we're doing is we've asked our staff here to share their memories of Chase Farm Hospital and their hopes for it, and we would be burying those alongside contents from the original, just the thoughts, and we'll be burying those alongside some of the original contents in the new time capsule. So I'd just like to finish by saying thank you. This would not have been possible without the imagination, the cooperation, the stamina of our patients, the local residents, our staff, the London Borough of Enfield, NHS Improvement, Enfield Health Watch, all of our design and construction partners who did such a fantastic job, and many, many other partner organisations. You are all here because you and your organisations played an absolutely vital role. Caroline and Natalie will be talking about that a little bit later. But from me, thank you so much. This is a wonderful collective team achievement of which we should all be very proud. And I'd now like to ask His Royal Highness to say a few words.
Normally you get us to unveil a plaque, but I'm assuming, because there's a cord, that's what I've been brought here for, is to pull a cord. But I was looking for a hole. I think I found the hole over there to bury whatever it was that you wanted to bury. Ladies and gentlemen, it's a huge pleasure to be here, particularly as I'm patron of the Royal Free Hospital and the Trust, and I'm amazed by the speed with which this hospital has been approved and built, and you've got into it. I happen to be patron of the Royal National Orthopaedic Hospital as well, around the corner in Stanmore, and it's taken them 30 years to get rebuilt. So I don't know what pull you have, but you might need to take over. But all these hospital redevelopments are about increasing the likelihood of better patient outcomes. And if it's something that has been drummed into my head by a number of people who are within the National Health Service, it's about we have got to do better at patient outcomes. And having been round the new orthopaedic hospital at Stanmore, and having been and looked at what's going on here and met some of your staff, it's quite clear that that intent is being delivered. And it's just listening to the changes that have taken place over the last 6 months and how patient outcomes are already being noticed, infection levels and other things. So I would just like to say congratulations on what you are achieving and what you have achieved in the short time that this hospital has been opened. But more importantly, the work that the National Health Service staff do on a daily basis continuously goes unsung. And I just want to pay my debt of gratitude and thanks to everybody who works, because there are so many people around this country who rely on your friendly faces, and that makes a huge difference to the patients when they come in. And you see so many different patients. Some are very worried, some are angry, and some are looking for what I would describe as compassion. And you provide it all, and you do it incredibly well, and in most cases silently. So thank you, and it is noticed. It really is noticed, the effort and the work that you do. So please, make the most of this fantastic new building, but a fantastic building is nothing without its contents. And it's the contents that I'm really wanting to encourage to do an even better job, because it's through all the work and the people and the community that live and work and make it possible for people to be better that makes the difference. So thank you very much indeed for all that you do. I wish you every success, and it genuinely gives me the hugest privilege and pleasure to not only say that this hospital is well and truly opened, because it has been for a few months, and you will notice that we are asked to open things a little bit later, just so that if there are any teething problems. But interestingly, in the conversations I've had, there's been no snagging points or pick-up points that normally one hears about, which is remarkable. So they who built it, and they who designed it, and I've no idea if you're here, but hands up, and then you can pat yourself on the back. Well done. And thank you all very much indeed. And now it gives me great pleasure to unveil this plaque.